With a panel of experts that are answering your questions about the COVID-19 vaccine. We're going to bring back in Mercy Medical Center's Chief Medical Officer, Dr. Robert Roos, here to discuss this a little bit more. I want to talk about vaccine equity. We know that Western Massachusetts has a smaller population than, say, the eastern part of the state, but Hampden County still has one of the highest new case counts in the state. So should we be prioritizing regionally?
So this is a really important question, and I would go out to say that if we are going to judge a vaccine campaign to be effective, it must be one that is equitable. We know that COVID has created additional health disparities and led to more death and hospitalizations among certain populations of people along racial, ethnic, and sociodemographic lines. And we must emphasize equity in our efforts when we are looking at the allocation and the distribution of vaccines. The way that right now the Commonwealth of Massachusetts is looking at how many doses and how equitable it is across different counties is by looking at the number of doses that are shipped to each county relative to the size of the population. And here in Hampden County, we're sitting at about 12%, which is putting us around the middle or perhaps even just below the average statewide, where some counties out east, almost 40% or higher, there have been doses shipped out to those counties representing a much larger percentage of the population. So I would argue here in Hampden County and some of the surrounding towns that have been hardest hit by COVID, that there should be an effort to distribute vaccine in larger numbers so that we can ensure that the health disparities don't get perpetuated and we can improve and protect the people in our community that need it the most.
And what about racially, for example? A coalition of civil rights leaders say that white residents have received 12 times more doses than black residents and 16 more times than Latinx residents. Is this a trend that you're noticing here? And what should we do?
It is. It is a trend that, there's about 10 times as many white people in the Commonwealth of Massachusetts as black people, and they're getting 12 times more vaccines. So there is a disparity there in terms of either distribution to certain communities and or the uptake, right, or the administration into communities of color. What we should do is really what the Department of Public Health and the Executive Office of Health and Human Services has just begun, which is a targeted outreach campaign on one hand, which is going to be focusing on 20 of the hardest hit communities, which will include Holyoke and Springfield here in Western Massachusetts. Those are efforts that are collaborative, that are investing some resources and funding to ensure that gaps are identified, barriers are addressed, and vaccine is accessible to those communities. So it really will take a collaborative effort, multiple stakeholders coming together to both address barriers, reduce vaccine hesitancy, and overall increase access and uptake in certain communities.
All right, and to that point, I want to bring in Springfield Mayor Dominic Sarno now, because this really does directly impact your city. Springfield, and you heard him mention Holyoke as well, are among the 20 communities statewide that have been prioritized for a state effort to increase awareness and access to the vaccine. So what kind of help does the city need?
We moved on our own already. Commissioner Helen Carlton-Harris and I formed the Vax Force. It's a very diverse group of people, 15 individuals, professionals, medical professionals, neighborhood leaders. First of all, to get out the correct information and facts and dispel any rumors or myths when it comes to taking the vaccine and showing them that there is safety and trust in this. In turn, DPH Commissioner Monica Burrell was on a Zoom conference call, a meeting with Commissioner Carlton-Harris and I just the other day, as Dr. Roos mentioned about the state outreach. So we were ahead of the curve on that. I will take any support that is not duplicate and to be additional help on us. But the main thing, and I think we've all said about, is if you can get me the vaccine, we know what to do here, especially with the medical professionals we have with Dr. Kerouac at Bay State and Dr. Roos at Mercy, AMR, Commissioner Helen Carlton-Harris. Now, I can't run a mass vaccination site, but I can make it more intimate and get out to our neighborhood areas. I've already identified 10 strategically located logistic areas in our neighborhoods with buildings and even houses of worship, if we can get our hands on the vaccine. So the Vax Force was already created about a month ago or so to be aggressive out there, diplomatically aggressive, to let people know, answer their questions, get out there and about. And then just the other day with DPH, Department of Public Health, Commissioner Monica Burrell spoke with myself and Commissioner Colton. We'll take any assistance that doesn't put across duplication on it, and they're offering that, and I'm glad that they're targeting the Springfield area. And we have to make sure we get that information out, because there's misgivings out there with certain population, what they went through many, many years ago. And we want to make sure that they're getting the facts, that this is good for them and their family. It's trustworthy, it's safe, and we want to get it to you. And we're going to be having a town hall, matter of fact, sometime in March with my Vax Force on it. So we are, with Commissioner Carlton Harris and I, and DPH Commissioner Monica Burrell had indicated Springfield is well ahead of the curve when it comes across the state of what we're doing.
I want to talk more about those neighborhood vaccination sites a little bit later on. Thanks for coming on the program.